What's up, Coastal Fitness Nutrition family? Dr. Devon Coughlin here. We have an awesome video for you about back pain that we're going to touch on in just a minute here. Before I get started, I just want to give a little disclaimer. My professional training is working with the spine. However, with that being said, I want to make sure that you still check with your healthcare provider. I can't diagnose your problem or give you advice not knowing what your problem even is. So I'm going to go over some guidelines about what I would consider serious back pain versus more moderate or mild back pain. But we're going to go through all that, but I just want to be clear, you need to check with your healthcare provider before you follow any of these recommendations, okay? So again, looking at this here, is your back pain serious? This is the topic we're going to talk about. And again, we talk about fitness, nutrition on this channel a lot, but I realize people that are active, whether they're athletes in sports or they're in the weight room, whatever it is that they're doing, most people are going to experience back pain at some point in their life. I want to say the stat on it is 9 out of 10 people are going to experience back pain at some point in their lives. Unfortunately, a lot of people that suffer with neck pain or back pain end up on pain meds, and that's one thing that we want to avoid at all costs. And so again, we're going to go over really just kind of defining what serious back pain is and also what your options are. All right, and so as we dive in here, is your low back pain serious? And we're going to focus on the low back in this video. We'll have a separate video about the neck, but in this video, we're going to talk about low back pain in particular. And so a couple things that you want to look out for. First and foremost, do you know what caused it? If you've been in a car crash or you had a weightlifting injury or some other known injury, that's really important, okay? If you have back pain that came out of nowhere, that could mean a number of things. But if you had a trauma that you know caused your back pain, that's the first step. All right, so again, number one is just figuring out what caused it. That's the most important. If it came out of nowhere, it could be something more systemic even causing it, which could be a whole another host of ways that you would deal with that, okay? So number one, do you know what caused it? Number two, does it stay in that spot in your low back or does it travel somewhere else? If it's traveling down your legs, or into your groin or into your buttocks, that means certain things. If it's staying local to that spot in your low back, that means different things. So again, second most important question, is it travel or stay local? Third, do you have any numbness or tingling? Another sign that you could have a major low back issue would be if you have numbness or tingling in your feet, your toes, down your legs. A lot of people will think, oh, I have bad circulation, or maybe there's something wrong with my blood sugar. Tingling and numbness in your legs or feet can mean that you have a pretty serious back problem going on. All right, so that's a third question. Number four, are you experiencing any weakness in your legs? Another major problem that we're going to find in the low back is that if you have pinching nerves or nerves that have been compressed or irritated from a bulging disc or herniated disc, something along those lines, you can actually get weakness in your legs. So some people will report, I go to stand up from a chair and I get weakness in my legs, okay? So again, that's another question that we're going to ask. And the last one here, does it feel better with movement? Does your back feel better when you walk or bike or just really exercise in any way? If it does, that's typically a good sign. If it feels worse when you move and better when you rest, again, typically that's going to mean it's a more serious back issue. All right, so let's get into a little bit more detail here. Again, if it's more serious, constant, you can't get any relief, those are signs that your problem is more serious. All right, now if you lay down or sit down, your back pain goes away, it's usually a good sign. If it's constant, you can't get any relief, even if you took over-the-counter meds, Aleve, ibuprofen, Tylenol. If you take those things and no relief, definitely a more serious sign of a back issue. All right, the next one here, if it does travel into your legs or radiates out from that area, again, that's a more serious sign and symptom that you have a serious back problem. Next, again, weakness in the legs, like I mentioned, that's going to be a sign more serious. If you cough, sneeze, or laugh and your back pain increases, typically what's going to happen is you're going to get a shooting pain somewhere, either up your spine, down your spine. If your back pain gets intense and shoots out when you cough, sneeze, or laugh, again, that's a sign of a serious back issue, okay? Lastly here, it gets worse with movement. Like I said before, if you go to move and it's getting worse, again, more of a serious sign. If you get better with movement, that's a good sign, all right? Last thing here, affects your bladder or bowels. Guys, this is like stop you in your tracks, very, very serious. if you have a back issue, serious back pain, and you start noticing with your bowels, whether you're losing control, like you have to go to the bathroom and you don't make it there, or if all of a sudden you find that you woke up with this amazing urgency to go either urinate or actually move your bowels, again, that's a bad sign that the nerves in your lower back are compromised and you've actually started to lose control of your bladder and bowels. That's an emergency. You need to go right to the hospital. All right. And so, again, these are all signs that your back pain is serious. So make sure you're listening to your body. You're listening to the symptoms that you're experiencing there. When we look at this, types of low back pain. Again, I would consider it mild low back pain if you are not having those symptoms. And if you have mild low back pain, stretching, strengthening your core muscles are going to both be really beneficial. All right. Lastly, I'm recommending you get evaluated by a chiropractor or a physical therapist. The reason being is that a lot of people will have what I would consider mild low back pain, meaning they can work, they can exercise, they can sleep, they can do all those things, but it's either they would consider it annoying or nagging. Annoying and nagging or mild can very quickly become moderate or severe. So this is a time that you want to get yourself into a chiropractor or a physical therapist. Make sure you get evaluated properly. And then typically stretching and strengthening is going to be all you really need to take care of it on your own at home. And then you get some professional advice from a chiropractor or a physical therapist. They might need to do some work with you as well to improve that mild low back pain. All right. I would consider moderate low back pain or something that's pretty much there a lot. Again, not debilitating, but it's there a lot. You definitely want to see a chiropractor first. And the reason I say that is you want to see a good chiropractor that's going to utilize imaging, whether it be x-rays or MRIs. They need to understand what's going on so then they can help you decide the next step that you're going to need care for. There's a lot of studies on this going back to the 1970s, and really they've been done with workers' compensation. So if a worker gets hurt at work, they have a couple options. All right, in most states you're going to have an option of like pain meds, surgery, things like that in more of a medical setting. Again, drug, surgery. Then you have the other option of physical therapy and chiropractic. Across the board, in almost any state they've done these studies. I know a lot of them were done in the Midwest. Again, going back to the 70s, they always consistently show the group that does chiropractic and physical therapy avoid surgery, they avoid drugs, they get back to work quicker, and they have fewer disabilities. Okay? So again, if you have moderate pain in your low back, you're better off seeing a chiropractor first. And if they send you somewhere like pain management or a spine surgeon, then you can go from there. But again, you always want to try most conservative first. Okay? If you have severe low back pain, like I mentioned before, it's always there, it's worse with coughing, sneezing, laughing, things like that, I'm still going to recommend that you see a chiropractor first. And the reason why is everyone's idea of severe is different, right? So some people have a low pain tolerance, some people have a high pain tolerance. Always, I would say, see conservative care first, all right, with a chiropractor. Again, they can get imaging, x-rays, MRIs, whatever could be needed there, and then they can refer you to the next level, whether it be a spine surgeon or a pain management doctor that might do injections in your back like a steroid or an epidural, something along those lines. But again, the truth is you want to start conservative. All right, really good doctors, whether they're physical therapists or chiropractors, are going to know, they're going to be able to tell you this is mild, moderate, severe, and they're going to be able to direct you where you need to go versus going to the ER or the hospital. Understand, they don't specialize in spines. So again, they'll often give you some medications and say, go follow up with someone else anyway. You want to get to a really, really good office, whether it be a chiropractor or a physical therapist that can diagnose the problem, refer you accordingly if you have severe pain. Odds are the chiropractor can help you anyway, even if you are severe. But again, there'll be a really good first line to be able to see what's going on there. All right. So again, that's the advice I have for you, is to check in with a professional and see what their opinion is to help you. With that being said, I want to wrap the video up here on how to prevent low back pain. All right, so again, our goal is that you're active every day. Remember, 7 days a week, consistency over intensity. I want to see you exercising, being active, really loving life and being fit, all those different things. So how do we prevent our low back pain and make sure that we don't get sidelined or miss out on our activities? All right, so number one here, I'm going to tell you, be active. If you work at a computer all day, which a lot of people now are, especially if you're working from home, you're on a computer 8, 9, 10 hours a day. That's horrible for your spine. All right, you've probably heard this before. Sitting is the new, it's like sugar for your teeth. Sitting is for your spine. All right, and so again, we want to make sure that we're active, we're moving. The best thing you can do for your spine is to be up and moving, okay? Number 2 is going to be chiropractic. So I mentioned before, if you're having back pain, see a chiropractor. I'm going to tell you, even if you don't have back pain and and activity and fitness is important to you, chiropractic has amazing preventative benefits and also increasing your athletic performance benefits. So again, I would see a chiropractor before you have any back issues as part of your preventative plan. Without a doubt, you'll do better. All the top sports teams, all the top colleges, athletes, professional and amateur are using chiropractic care, not just for pain relief, but again, for prevention and performance enhancement. So I'm going to recommend you see a chiropractor. Focus on your flexibility, number 3. A lot of people think it's all about strength, but especially as we get older, what's going to happen is your strength is going to be okay. You're going to lose flexibility as you get older. When you're younger, you have more flexibility than you have strength, and then that starts to change as we get older. All right, so again, we want to focus on flexibility. Basically, from like the age of 25 and on, we want to focus more on flexibility than we do on strength. Again, focus on that. Number 4, smart exercise and core strength. When I say smart exercise, don't try to deadlift like 400 pounds if that's not, what your body type is or the age appropriate for you. You want to do exercises that you can do on a regular basis, again, 7 days a week. If you're overdoing it, you're going to be sore for 2, 3, 4 days, and you're going to be missing out on that. You're also going to be increasing your risk of injuries. So smart exercise and building that core strength. The next one here, again, like I mentioned before, consistency over intensity. I'd rather see you work out 7 days a week, varying those workouts, different things each day, than going really hard 2 or 3 days and then having to rest the rest of the time. All right, so consistency over intensity. Last few here. Be at an ideal weight. Again, most people realize if they lost weight, they would have less back pain. Again, it's going to be the same for all your joints, your hips, your knees, your feet. You want to be at an ideal weight. There's different things like BMI, there's different things like body fat percentages, all those different things. The truth is you want to have a BMI that's going to be appropriate for your height and weight. You want to be lean, you want to be muscular. Certainly, obviously, most people realize if you're overweight, you're going to have back pain. We want to have a diet that's anti-inflammatory in nature. Again, we've done different videos on this when we talked about healthy oils versus unhealthy oils. The healthier your diet, the more anti-inflammatory your diet, the higher it is in omega-3 fatty acids, the less joint pain and back pain you're going to experience, okay? We look at sleep position. We're going to do a video on this in more detail. The short story is you don't want to be a stomach sleeper. You want to make sure your spine's neutral, whether it be on your back or your side, and we want to make sure that our sleep position is going to be protecting our spine. All right? Ergonomics. Again, if you work at a computer all day long, you want to make sure that you have proper ergonomics. We'll have a video on that as well, no doubt about it. But again, you want to have good ergonomics. If you're spending a third of your life sitting at a computer, 8, 10 hours a day, you want to make sure that we're looking good in the ergonomic category. And then lastly here, we want to have strong feet. And what I mean by that is if you have arches that are collapsing inwards, like really, really flat feet, or you have arches that do the same, they're collapsing outwards, that can cause issues with your lower back, your knees, your pelvis. We want to have strong feet. Again, we'll talk about exercising barefoot in a future video here. And if you don't have strong feet or you have really weak arches or damaged arches, I'm going to recommend that you use orthotics when you exercise and work out and go about your day. All right, and so again, these 10 things here, going through how to prevent low back pain. Really, really packed video. I know it's loaded with information here. Again, just make sure that you check in with a healthcare provider. Please use these tips here to prevent your low back pain. Should you find yourself with low back pain again, reach out to a chiropractor, physical therapist. Make sure that you're getting the information you need and you're getting the care that you need as well. All right. It's been Dr. Devon Coughlin, Coastal Fitness and Nutrition. Make sure you subscribe to our channel on YouTube. Follow us on Instagram and Facebook. We're going to be giving these informational videos for free. They're going to be coming at a minimum on a weekly basis. And again, our goal is that you are healthy and active all the way up till you're 100 years old. That's the goal with Coastal Fitness Nutrition.